How critical can a health crisis get? In the Gaza Strip, 2/3 of hospitals and 1/3 of clinics have ceased operations. This is a reality today. Gaza, a region already grappling with a myriad of challenges, is now facing an unprecedented health crisis. The World Health Organization, or WHO, has issued a stark warning. The healthcare system is under immense pressure, with over 5,000 lives lost and 15,000 people wounded due to the ongoing conflict. This is not a mere statistic, but a human tragedy unfolding in real time. Hospitals and clinics, which once buzzed with life-saving activities, now stand silent and empty. The impact is far-reaching, affecting the most vulnerable first: the sick, the elderly, the injured. The situation is dire, with Rick Brennan, the WHO's Director of Emergency Operations for the Middle East, stating, "We fear an increase in mortality rates among people with chronic illnesses." In the midst of this crisis, the World Health Organization is striving to intervene and alleviate the situation. The WEO faces an uphill battle in Gaza, a region steeped in conflict and turmoil. The organization is tasked with the enormous responsibility of addressing the health needs of a population deeply affected by the ongoing conflict. The role of WHO in Gaza is manifold. It is not only providing immediate healthcare aid, but is also working on establishing a sustainable healthcare system. The organization is collaborating with local health facilities, enhancing their capacity to deliver effective healthcare services. Amidst the escalating violence, the WHO has been scaling up its efforts to meet the health needs of almost 200,000 people in need. The challenges that the WHO faces in Gaza are formidable. The violence has led to the displacement of over 77,000 people and has caused significant damage to 30 health facilities. These circumstances have created a staggering demand for health aid, stretching the capacities of the WHO and other aid organizations to their limits. Despite these hurdles, the WHO is undeterred. The organization is rallying its resources, employing innovative strategies to deliver aid. It is working tirelessly to ensure that people in Gaza have access to essential healthcare services. Their efforts cover a wide range of areas, from providing immediate medical aid to those injured in the conflict, to facilitating access to chronic disease treatment for those suffering from long-term illnesses. The WHO is also raising global awareness about the dire health situation in Gaza. It is shedding light on the immense healthcare pressure in the region, which has seen over 5,000 fatalities and 15,000 wounded in the conflict. The organization's Director of Emergency Operations for the Middle East, Rick Brennan, has issued warnings expressing fears of an increase in mortality rates among people with chronic illnesses. The WHO, despite facing numerous obstacles, continues to fight against this health crisis, hoping to prevent a real catastrophe. It is a testament to the organization's commitment and resilience, as it strives to uphold its mandate of ensuring the highest possible level of health for all people, even in the most challenging circumstances. The international community is not oblivious to the crisis. There have been numerous responses, some more helpful than others. The United Nations Relief and Works Agency, for instance, is facing an uphill battle in its efforts to support the more than 5 million registered Palestinian refugees. The agency's funding is in a danger zone, with dwindling resources and rising costs threatening its operations. The war in Ukraine and other crises have led to a decrease in donor support, exacerbating the situation. Despite these challenges, the agency is seeking to diversify its donor base and move away from dependence on voluntary donations to ensure more predictable funding. Without adequate support, further cuts in essential services could lead to increased anger and instability in the region. The World Health Organization, too, has been active, scaling up its response to provide health aid to nearly 200,000 people in need. The International Committee of the Red Cross has appealed for $16 million to help the people in Gaza, a region that will take years to rebuild. Meanwhile, the United States has voiced support for allowing humanitarian aid into Gaza. The United Nations humanitarian chief will travel to the Middle East for negotiations over aid, showing a commitment to alleviating the dire situation. Yet, not all responses have been helpful. Certain parties have been less cooperative. Israel, for instance, has been accused of not cooperating with efforts to deliver humanitarian aid to Gaza. The Rafah crossing, the only exit out of Gaza, has been rendered nearly inoperable by Israeli airstrikes. The international response has been varied, but the need for more assistance and cooperation remains urgent. The health crisis in Gaza is a stark reminder of the human cost of conflict and the importance of a collective global response. What does the future hold for the health crisis in Gaza? It's a question that demands serious thought and action. As we look ahead, the situation seems daunting. The World Health Organization has warned that 2/3 of hospitals and 1/3 of clinics in the Gaza Strip have ceased operations. Over 5,000 lives have been lost and 15,000 individuals wounded in the ongoing conflict. The healthcare system is under immense pressure, and without immediate intervention, the future looks bleak. If the current trend continues, the health crisis could escalate into a full-blown humanitarian disaster. The burden on the remaining operational health facilities would be enormous, leading to a potential increase in mortality rates, particularly among people with chronic illnesses. The lack of access to basic healthcare would also exacerbate the spread of infectious diseases, creating a public health nightmare that could extend beyond the borders of Gaza. But this doesn't have to be our future. There are steps we can take to avert this healthcare disaster. First and foremost, international cooperation is essential. The United Nations Relief and Works Agency for Palestine Refugees, or UNRWA, is already seeking to diversify its donor base to ensure more predictable funding. But more support is needed. Increased funding and resources could help restore critical health services and rebuild damaged healthcare facilities. Secondly, it's crucial to facilitate the delivery of humanitarian aid into Gaza. Currently, aid is stuck at the Gaza border, with only 24 hours of water, electricity, and fuel left before a real catastrophe occurs. Overcoming political and logistical hurdles to ensure the smooth delivery of aid is a must. Lastly, we need to advocate for peace and stability in the region. The ongoing conflict is at the root of the health crisis. A peaceful resolution would not only alleviate the immediate health crisis, but also pave the way for long-term healthcare development in Gaza. The future hangs in the balance. It's up to us, the international community, to ensure it doesn't tilt towards a healthcare catastrophe.